So, hi, Dr. Bhatt. Nice for you to join us today. Today, I'm going to be interviewing you for our Spotlight series for the J1 Scholars at USF. So, could you start off by just telling us a little bit about yourself?
Yes, sure. Well, hi Apurva, and thank you for connecting today. So, my name is Priyanka Bhatt, and I have done my Bachelor's of Pharmacy and Master's of Pharmacy New Drug Delivery Systems from India, and I have done my PhD in Pharmacy with major in pharmaceutics field that is also from India. So, as long as I completed my PhD in 2018. So actually my defense was in 2017, like late 2017, and I got like degree awarded was in 2018 January. So I was looking for some postdoc positions like from my PhD only. I was very much determined that I want to do postdoc in US. So I was like doing a lot of efforts in that direction, and I came to US couple of times to present my research work also in certain society annual meetings such as like AAPS, which is American Association of Pharmaceutical Scientists. So then I was like applying for certain positions. Actually, I was looking for a lab where people are doing like pharmaceutics or formulation development or drug delivery because my whole background was that.
Right.
Yeah, and then I got opportunity here, and from last 3 years I have been working here as a postdoc in Dr. Vijay Sutaria's lab in College of Pharmacy.
Oh, that's awesome.
Yeah.
So, you've been here for 3 years. Why did you choose USF?
Well, I was actually looking for like big research universities in US. So USF is of course one of them, and I was applying for positions as I said because there are a lot of universities doing molecular biology and like biological and molecular based research, right? But there were many, not many positions I was founding that have that has the drug delivery and formulation development research. So I was applying for, and then luckily I got like interview from USF, and our research interests were matching, like Dr. Sutaria's lab and my research background was matching. And of course, like Florida is like very much popular state in the US, and I was coming from India, so I thought there will be not much weather change, or it will be very much easy for me to accommodate here. So then I chose USF.
That's a
And
great.
that time actually I have heard a lot of about USF and its international programs. A lot of students from like my juniors, and they were like taking admissions here in master's programs. So from USF website also I got to know that this university is having like kind of mixed environment, having like global environment, having students from different countries. So that would be very good chance to do a research like in this kind of university. So then I got here.
That's exciting. That's so nice. So you told me that you're doing like this formulation research and drug delivery. So what is your current project?
So currently, actually, Dr. Sutaria's lab is focusing on development of drug delivery systems for eye. So there is one disease called age-related macular degeneration, which is an elderly disease, and we are specifically working on its advanced stage. So currently there are treatments available in the market. So for that, a patient has to go every so based on the severity and stage of the disease, patient has to take like every 2 months or every 1 month or every 3 months intravitreal injections. So that is injections into the eye of anti-VEGF agents, which are like medications for this disease. So we are working on developing sustained release formulations for this anti-VEGF agents just to have the sustained release of this medication, I mean this anti-VEGF agent into the eye for longer duration of time. And by doing this, we can, like we are hoping to reduce the frequency of intravitreal injections. So that will be much more patient compliant. So right now I'm working on development of PLGA nanoparticle, which is FDA approved and biodegradable and biocompatible, safe to use polymer, and that has a property to sustain the release of the drug loaded into the nanoparticle. So we are working on various anti-VEGF agents. One of them is sunitinib malate, which is the name of the drug. And I'm working on making nanoparticles of this drug using PLG as a polymer. And this nanoparticles are also incorporated into thermoreversible gel. Now this gel is called thermoreversible because at room temperature it is as a liquid phase. So when physician is injecting the formulation into the eye, that would be much more feasible. But as soon as it reaches the body temperature, that is 37 degrees Celsius around, so that time this liquid formulation will form a gel. So it will form a depot kind of formulation into the back of the eye, which will slowly release the drug for certain days and certain months. So this is the technology that we are working on. And so far we have published a couple of research data, and we also applied for patents also for this technology. So from last 3 years, like I've been working on developing this kind of formulations in Dr. Sutaria's lab.
That sounds awesome. It's really interesting, the long-acting.
Yeah, and it is very interesting when you check, because once your formulation is ready, you need to check the parameters like pharmaceutical parameters and characterizing parameters of this formulation. And once the formulation is optimized with its size or zeta potential, these are the parameters that we usually check. Then we check we evaluate this developed formulation into cell lines, and then we take this formulation to the in vivo, which is very interesting to know, because when we have the animal model with us and we are working on this kind of formulation, so this experience is really very interesting, and it is like we are really hoping that we are having a very good promising data from like preliminary studies. So we are really hoping this technology will be very helpful for the AMD patients.
Wow, I'm actually so curious about that. So have you ever done that before when you went from in vitro to in vivo, and did you have a significant difference in the effect?
Yes, so we are actually working on laser-induced CNV model, which is we need to make a model first. So using a mouse model, we actually do a laser burn into the eye of the animal, and then we intravitreally inject the formulation that we develop to check whether it is helping in recovering or healing or reducing the neovascularization or not. So we have actually got very good data with our study that after 2 weeks of interval, like after 2 weeks of our treatment, formulation group is like reducing the neovascularization area. So now we are hoping for like next study in more number of animals, and also we are actually working on planning some other animal studies, like to check the toxicity and everything.
Right.
Yeah.
And so how long does that process usually take?
Well, it depends, because when you are working with animal, you never know that it will give you a good response or not. So we are currently working on first planning all the studies, because we need to go through the IACUC process and everything. So right now we are like in a process of like ordering animals and everything, and then we will start the study. We will start actually like from maybe this or next month. So it usually takes mostly around 3 to 6 months. Yeah, it depends on like how you're getting response from animals.
Yeah, And so how has COVID-19 kind of affected that process?
Well, it was very, see, from, I guess, from last March, there was like lockdown and the cases were increasing like very, very immediately. So it was kind of difficult because we were having cells running and everything was like on track. So it was very difficult for us to maintain the cells or, but then in some days like actually we could figure out that, so we actually um, stored our cells in liquid nitrogen, and there was that time I was not involved in animal study, so that was not a issue with us. And as soon as everything got settled and now like situation is very much changing and improving, so now we are planning for animal study. And meanwhile I was having a lot of data that I've actually generated from my experiments. So when I was working from home, actually I was working on writing manuscripts and writing and submitting grant and assisting my PI in writing grants. So that was like in that time we could actually utilize our time in writing, because usually when you are working and you are like doing studies and experiments, so that time you really don't have that much time to pay attention to writing, which is very important part of research. So actually we could utilize this time in writing manuscripts and submitting grants, and now we are back on track.
Wow, that sounds like it worked out perfectly for you guys then.
Yes, and even the resources at USF and people and staff, they all are very supportive in this like throughout journey. So the recommendations that they have made for like students and staff members safety, each and every person is helping, like frontline healthcare workers are helping a lot. So I really appreciate whatever they have done for us, and I'm thankful to all of them.
Yeah, it's really nice to see everyone coming together to work.
Yes.
Yeah. Well, I really appreciate you taking the time to talk to me today. Thank you for telling me everything about your research. It's really interesting, actually. I want to learn more about it. So I really appreciate it.
Thank you very much for giving me a chance to speak about my research, and I'm glad to talk to you today.
Yeah, of course.